Hi, everybody. Sorry I'm a little bit late. I was having connectivity issues on my side, so sorry about that. Looks like folks are mostly coming in. I hope everybody's having a good day. And I think I today, because Melissa is going to not be joining us, is that correct, Deshawn?
She will be joining, but she'll be joining a little later.
Okay. All right. Very good. So Deshawn and I think when Nandi joins that we're going to all three of us be working to bring us through our agenda today. And I'm going to actually pull it up in front of me. I'm sorry, I'm using two different computers. My computer was not working today. So everyone's putting their name and where they're from in the chat. Is that correct?
Yeah, that's correct.
Awesome.
And Amy, I pulled out the PowerPoint to show the meeting.
Oh, excellent. Okay. So I think while people are putting their name and where they're from in the chat, I think consistent with our past meetings that we were hoping to start the meeting with a sharing of some experience. Hopefully that we're encouraging anyone on our meeting today to share some of their lived experience um, related to how their transition to parenthood went. Is there anyone that would want to start us off today? I was thinking last meeting we didn't have anyone share in our last meeting either, and I thought maybe that I would invite an individual with lived experience or an individual who could share the experience of a friend or family member, maybe that was de-identified, that could help us root this and the lived experience of folks who are who have struggled with maternal mental health conditions, or even a clinician, if a clinician felt comfortable sharing again some information and perhaps a de-identified example, a small brief case example that could help us root this in the experiences of the parents that we are, the mother's parents, birthing individuals. I have lots of cases, but I kind of don't want to hear myself talk today, so I'm gonna hold back. What I might do is I have a case that I would love to share with this group that I didn't come prepared to share it today, but what I'll do is I'll maybe bring it with me next time, and if there isn't anybody that wants to share their own lived experience, I'd be happy to share a de-identified case example of that I think would illustrate why we're all here and what we need to be focused on. So next time.
Amy, I see that Lenore has her hand up or had her
Oh,
hand up.
amazing. Sorry.
I did, not for personal lived experience, although I do have a 10-month-old at home and really bash my breast pump with a baseball bat. But I wanted to just not leave you hanging and happy crickets. But I think at Children's National, we feel really passionate about this. I know there's a lot of the caregiver, the mother is not, our patient, but I think we see true value in really addressing like maternal and caregiver health in terms of the family unit. We just see that time and time again in our patient practice that you can't have a healthy family unit if there's PMADs involved. And so in my personal practice in the pediatric emergency department, a lot of times we'll have caregivers come to the ER, maybe even saying something as simple as, my baby's really fussy. And when we get down into it, really, there are kind of layered aspects of, both postpartum depression, sometimes an anxiety component, sometimes suicidal ideation, or occasionally maybe even postpartum psychosis or infanticide. And it's just really, telling to us that you can't just go by the physical complaint, that, you have to address the mental health needs of the family as well. And so we've really been proud of implementing postpartum depression screening in our emergency department using the Edinburgh, and being able to provide immediate resources and linkage to care in anything from cold line capacity to warm line referrals and crisis intervention as needed. And so that's not a personal lived experience, but personal professional practice, and part of why I feel like this work is just so important. I don't know if that's helpful.
Thank you, Lenore. I appreciate that. And I think that the lived experiences of people who are doing really important work in the trenches, as they say, with families, I think is a really important lived experience. So thank you for sharing that. Is there anybody else that feels like sharing a little bit today before we dive in?
I see Crystal Jackson with her hand up as well.
Awesome.
Hi. Yeah, I did have my hand raised. My name is Crystal. I'm a birth and postpartum doula. I am a task force member and subcommittee chair for one of the subcommittees here. And also, I'm a mom. I have a 4-year-old son. His name is Malcolm, and he's the most amazing thing I could have ever imagined. And my birth experience versus like my birth plan were two completely different things. And I think that all culminates into like why I'm here doing what I do now, as a doula and as a member on this task force. But to keep it brief, I was planning a water birth at a birth center. I got to the birth center and they were like, "Oh, Crystal, we cannot support you here. You need to go to the hospital." And when I got to the hospital, I'm like strapped to the bed. I have this IV in my arm, and just like everything is not at all what I had envisioned or planned or thought would be my birthing experience. So I was completely terrified, and I had people there. My partner was there, my parents were there. I had midwifery care. Thankfully, they followed me from the birth center to the hospital, but I still felt very alone and like, like I just didn't know, like what was going to happen, if I was going to make it home, if my baby was going to be safe, like any of that. And so, I got home, and then like 2 days later, we came home on a Friday. It was daylight savings time. And that Monday, my partner's like, "All right, going back to work." And I'm just like, "Whoa, this is like nothing again, nothing at all that I had planned." So of course, like I have some accountability in that conversation with him, but either way, that's how it panned out. And I just had to do everything on my own as far as, like the birthing experience, the parenting, my postpartum experience was just me doing what I had to do to be strong for myself and to be strong for my son. And so now, as a doula, I provide support to families so they don't have to do it all alone, and so that they can be confident and have self-care practices built into their journey, and also be plugged into a community. As a doula, I have tons of resources to share with families, and that's what I do. That's what I love to do. And so in this task force here, just being a advocate for maternal health, maternal mental health, and human rights in general, I think it's just important to have these conversations, share information, and make sure that the policies support families everywhere that need care. Thanks for letting me share.
Thanks, Crystal, for sharing. Thank you so much for sharing. And I think to hear about your experience and how you've parlayed that into helping others, and also and it sounds like it led you to a calling and a passion. Like you can hear it in your voice for being able to support other birthing individuals, provide them with education and community. That's awesome. Thank you for sharing it. Is there anybody else? I don't see hands up on my screen because I logged into Cisco WebEx through the online, not through the app, through the application. So mine looks a little bit different. But is there anybody else, Deshawn, that raised their hand?
I don't see anyone else.
Okay. Well, thank you, Crystal and Lenore, for getting us started. And is our thinking that we're going to go right into talking a little bit about the PQC?
Yeah, so we have Yulette Gray on, give a brief overview of the PQC.
Amazing. So Yolette Gray is from the DC Hospital Association, and she's going to really do an overview of the PQC for us and give us some time to ask questions. And this was in response to our meeting last time where we did, and actually in meetings and also in subcommittees where the important work of the PQC was connected to some of or was a thought of how we might connect perinatal mental health work in the city to what's happening in the PQC. And so Yolette, I'm going to turn it over to you to do your overview.
Yes, good afternoon. Can everyone hear me? Okay. I've never used WebEx before to present. I'm trying to see if I could share my screen for my presentation. Deshawn will stop sharing content as soon as you start sharing. Okay, I'm reading. Let me see here. How do I share? Just bear with me for a moment. I click on this. Does that allow me to share? Maybe not. Entire.
There's a little arrow pointed up next to the kind of stop and start video button at the bottom. Do you see that?
Yes, I think I'm there.
Okay, amazing.
I think I'm there. Can you all see my screen right now by chance?
We can.
Awesome. All right, you can see me, but I can't see you. So we'll just go with that. All right, good afternoon, everyone. I'm Yolette Gray. I'm the Director of Public Policy and Community Engagement at the Hospital Association, and I serve as the Patient and Family Partnership Director for the Perinatal Quality Collaborative. I'm happy to be here to share the overview of the PQC work with you all. The District of Columbia Perinatal Quality Collaborative serves as the district champion for reducing maternal mortality, improving health outcomes, and narrowing racial and place-based disparity in maternal health through a data-driven quality improvement approach. Our vision is to create and support measurable quality improvement approaches that decrease maternal morbidity and mortality and contribute to all women thriving, being strong, and having a healthy pregnancy. Our two main goals right now is that by January 2026, the PQC will reduce pregnancy-related morbidity and mortality among women in the district with specific attention to non-Hispanic Black women in Wards 7 and 8. And by January, the PQC will work with hospitals to reduce the impact of systematic racism to decrease maternal morbidity and mortality. This is the PQC's organizational structure. The PQC is made up of a large body of stakeholders, which divide into smaller groups to achieve the overall goal and mission of the PQC. The full committee provides input and recommendation on issues. There is a bidirectional relationship with the advisory board. The advisory board is a group of stakeholders from the full committee that actually serve as champion and clinical leaders from all the birthing facilities and other champions in the district, and they represent the voting body of the PQC. You have here on the left the administrative team, which basically support the entire collaborative. Their primary responsibility is to provide the initial vision, direction for the PQC, brainstorming, providing feedback, and initial PQC aim related documents and discuss ideas for a larger meeting and agenda items. We have a data work group that basically look at the data. This work is all data driven. So the working group look at the data to identify any gaps, meaningful changes that needs to take place. And that's how we actually decide which bundle we will focus on for the PQC. The clinical implementation work group consists of all hospitals. This is where the work is happening inside the facilities. All the hospital has their own internal team that are working on the current bundle that we are working on. And then we have the Patient Family Action Network. At the beginning of the PQC, we recognized how important it was to include the patient voice. And so we have 2 patients currently that are supporting some of this work. One in particular that's participating in hospital meeting, providing input in the work that's being done. And then we are currently also recruiting to add additional patient partners. All right, next slide. This is our busy timeline and milestones. I don't expect you all to read this, but I wanted to show part of the work that's been happening and also highlight some key dates here that I think are important. We started this work in 2020. By November 2020, we had a full committee meeting engaging all stakeholders. In March 2021, the PQCA was accepted as the Alliance for Innovation and Maternal Health Partners. And also the advisory board voted on our first AIM bundle. In September 2021, the PQC began implementing the AIM Severe Hypertension and Pregnancy Patient Safety Bundle in 100%, all 5 of the district birthing facilities. Hospitals. And then between March 2022 and June 2022, we provided education through racial equity and respectful care training to our hospital partners. Then in October 2022, we had the AIM new data metrics and hypertension bundle was implemented. So those are some key dates that are important as the work continue. We recognize this timeline. We are working on updating the timeline to reflect the current work that's being done currently. The PQC is enrolled in AIM, as I mentioned earlier. We are funded through DC Health, administered by the Hospital Association and with many partners across the district, supported by the district as well as ACOG. This slide focuses on the first bundle, the AIM hypertension bundle. As I mentioned, the work group looked at the data at the time to determine what was the first bundle the PQC should focus on. Using an SBAR format, they identified hypertension as the first bundle. And so the hospitals have been working on tackling that bundle since then. This here is an overview of the hypertension bundle components, focusing on the 5 R's through the AIM. Have developed those 5 R's that we should focus on. The readiness is the first R, recognition and prevention, response, reporting and systemic learning, and respectful, equitable, and supportive care. So these are some of the components that the hospitals have been working on to address the severe hypertension and preeclampsia at their facility. So adopting the AIM bundle, the Alliance for Innovation on Maternal Health, Severe Hypertension and Pregnancy Patient Safety Bundle provide guidance to the hospitals to coordinate and standardize the care provided to women with severe hypertension during pregnancy and in the postpartum period. Participation, the clinical implementation work that I mentioned, those participants, they have the opportunity to network, to learn and share information and resources with peers across the district, access subject matter expertise, coaching and support for multidisciplinary faculty team, and quality improvement expert. It tracked their progress toward shared, measured, and received support in using data to drive improvement. The hospitals are working currently on the bundle. They continue to meet monthly. They are fully implementing the bundle right now using the documenting their work through the A3 format, which focus on improving the rate of severe maternal morbidity among patients with severe hypertension, preeclampsia, looking to improve hospital data collection efforts and reducing racial and place-based disparity among Black women, pregnant and postpartum patients in the district. The program staff, right now we have Melissa Fries from MedStar, who's the Executive Clinical Director. We have Gail Hurt, the VP of Quality at the association, serve as the Project Director. Myself, with Kaya Moore, who is the Project Manager. And then we have recently hired a Senior Health Data Analyst, Haywatt, who is looking deeper into the data as we submit data to the AIM portal. I will stop right there and see if I can minimize my slides so I can see you all and see if there are any questions. I'm happy to answer any questions that you may have. Let me see how I can do that. All right, let me see. Okay. I think am I still sharing?
You are.
Okay, let's see if I can stop. All right, there you go. Okay, we did that. Awesome. So I'm happy to answer any questions that you all may have regarding the work of the PQC. There are conversations currently happening on adapting a new bundle. Amy and Gail and I have been in communication. We've been in meetings, having conversation around mental health. And so there are some additional work happening, and we'll update our timeline to reflect that.
That was going to be my question, Ela. Would you mind, for folks that are really learning about the PQC, even spending just even like a minute or so doing kind of like a high level overview of the perinatal mental health kind of the sort of the AIM bundle and how the bundles sort of that there are kind of how the bundles work for AIM, and that the PQC process and choosing and maybe perhaps an example of how the hypertension bundle, for example, was chosen first?
Yeah, so the work group that I mentioned looked at the data, looking at the data for the district in particular, and looking at what is the top cause to morbidity and mortality for women, Black women in the district. And from that perspective, they identified that at the time, hypertension, severe hypertension was what we should start with. The conversation that we are having currently around some hospitals feel that they are ready to address mental health. It's just finding the data, looking at the data that what they have right now. What is the data showing for those hospitals? Because there is also cardiac showing up as another possibility, and then substance use is another one. So what we are doing right now is having conversation with the hospital, looking at their capacity, as well as, because they're still working on the bundle, what is the capacity? How do we work with a different team to see how we can leverage the work that they are doing with the hypertension, and then start a new bundle, also looking at the work group. Currently, the data work group is not meeting because there is no need for them to meet, but we are going to resume their work so that they can look at the data and identify what's the key points for now.
Thank you.
Any other questions? I can't see everyone's hand. I can only, so I'm gonna scroll through and see why he hands. Yep, I don't see any hands.
Are the AIM bundles, and my question is for the group, are the AIM bundles, are you learning about those for the first time today? Like, I guess raise your hand if you are, if the AIM bundles is new. Okay. Okay. Yeah, it's really interesting. And actually it might be worthwhile for us at one point to even have our group take a peek at there's a new AIM bundle that came out at the beginning of 2023. And essentially it's in exactly the format that you'll let, are they all in the same format? The readiness, the response?
They are in the same format. It was different before, but they added respectful care to that bundle as the fifth R. And so, yeah, all of them look at their respectful care. Before, the respectful care was separate by itself, but now they all incorporated in all the bundles.
Excellent. And there was an original AIM bundle on maternal mental health that came out, I believe, in 2016 or 2017. And the perinatal mental health AIM bundle that came out at the beginning of 2023 was revised. And it's really incredible. And it might be something that we want to look at, because essentially it lays out the kind of the standards by which a medical setting, for example, should be approaching screening for perinatal mood and anxiety disorders, should be approaching prevention, should be developing workflows for referral workflows. Essentially, it kind of lays out the best practice for how to do this in various medical settings. Leah, yeah, there you go. And so it might be worthwhile, even if we have some time today, we could even go on the AIM website and even kind of scroll through the bundle so folks could take a look at it. It's very detailed, and essentially it kind of lays out a plan for how a hospital site would take on a quality improvement project of fully addressing the full scope of perinatal mood and anxiety disorders in their site. It's really quite an incredible resource.
It is. I was trying to get the link for you all, so I'll look for the link and share it in the chat if I can for that. Any other questions? All right, if none, thank you so much for your time, everyone. But if you have any additional questions after this, please feel free to reach out. We are happy to address any questions you may have. Thank you.
Thank you very much.
I think I put it in the chat. I think that's the right link for the AIM safety bundle for perinatal mental health.
Well, it doesn't let me click on it, but I think it's because I'm in a different.
Andrea, that's the one I have too. So
that looks right. Yeah, it might be worth folks kind of thumbing through it, and if we have time today to pull it up for us to look at it, because I think regardless of whether it becomes, something that the PQC would want to tackle directly or not in the form of like their next formal bundle, like it's definitely something that could be a tool or a reference that we might use as we think about making, for example, recommendations regarding, that the how of screening and making recommendations yeah, I think as we think about the recommendations we're going to be making over the course of this year, I think this bundle could help us think that through.
Do you think there's any hospitals that have already done the bundle outside of the perinatal quality group?
I think that we have a pretty good version of it at Georgetown and at MedStar Washington Hospital Center, because the frame of the bundle, it's very similar to the bundle in 2016, 2017, and we actually used the bundle to guide some of the projects that are happening there. So I think and since I work at MedStar, I'm knowledgeable about what that looks like. like if
I
we,
would sort of think that there may be other people outside of that who've already done the bundle, because a lot of departments started the bundles when the bundles came out.
okay. You mean implemented the entire perinatal mental health bundle?
Well, I know, they'll implement them one by one, so they'll go, sometimes even simultaneously, they'll have a work group working on hypertension and another one working on mental health. So I was just wondering if the perinatal mental health group is one thing, but I wonder if each health system has done it on their own like yours did.
It's a good question. I mean, we have folks from other health systems on the call, or even familiarity with other health systems. Are you all, I mean, given that it just came out in February of this year, I think that it's probably unlikely that people have done it soup to nuts. And I think also the soup to nuts is screening, it's training for providers, it's referral workflows, it is resource directories, it is developing, crisis action plans for multiple settings and it is incredibly thorough and comprehensive. And so I'd be shocked, because I would imagine hospitals would need resources to do this. And so I'd be shocked if they were able to do the whole thing.
Yeah, if I can chime in real quick. So the hospitals did start the hypertension bundle. All of them had started some components of the hypertension bundle before we adapted it through AIM. As far as mental health, the data we have is they are interested in doing it, but of course it's the capacity, it's like you mentioned, the resources, etc. So right now we are not aware of any hospital that's currently doing it besides through our conversation, Amy, with Georgetown. So what we are doing is basically trying to gather that information to see how can we implement a bundle such as mental health. Should we do the whole bundle or part of the bundle, just to alleviate some of the loads that they may have to take?
Thank you, Yolette. There was also a question in the chat that I'll put out there. Can you speak to from Alana? Can you speak to the strategies the PQC might use if they implement the PMH AIM bundle, since so much of the interactions might occur outside of the hospitals? So many of the AIM bundles are hospital related, but PMH can be seen throughout the 2-year period. Great point. Great question.
Yes, that is a great point, and that is the conversation we are having. And actually, I see Trisha is here. We talked about connecting with Trisha as well around the primary care, because yes, a lot of the work is outside. So the conversation with Amy, with other external partners that are outside the hospital, of how do we make that connection. It's one thing to start the bundle at the hospital, but yeah, a lot of the work happened outside. So we need to think about the collaboration, the partnership, the external partnership that needs to be established as we work through either part of it or implement the full mental health bundle.
Are there any more questions before we move on to Trisha Quinn and her presentation overview of DC Next? Thank you, Trisha, for joining us today.
Thank you for inviting me. I had hoped to have Stephanie Wells, who's part of the maternal health context team, join me, but I do not see her on, so it'll maybe just be boring me.
I'm here, Trisha.
Nandi, is that you?
Yes, this is she.
Awesome.
Sorry, everyone. Sorry for my tardiness. It was an emergency. But I'm happy that you all are here. But I'm also here if you need me.
Awesome. I would love to tap into your expertise as we do this.
Okay.
Can you guys see my screen? Or Deshawn, are you sharing slides or am I?
I can see your screen now, but happy
Okay.
to share whatever you prefer.
I am also, Yolette, not skilled at sharing on WebEx, but let's see if I can get this into slideshow mode. How's that? Is that working for everybody?
Looks great.
Awesome. So Nandi, I'm just going to go through these quickly and maybe pause and just like let you fill in from your experience, since you and I haven't had a whole lot of time to talk about this. But just sharing a little bit of information from our Maternal Health Equity Action Lab. For some of you, this will not be new. I acknowledge that. But Deshawn wanted us to come and just talk a little bit about the work, maybe for folks who aren't familiar, and share what some of the innovations we are either testing now or have tested in the past. So it all started for us with human-centered design and using the tools of human-centered design around maternal health equity. We're working from 3 phases of human-centered design. The inspiration phase, where you do deep dive interviewing with the end users and really try to learn from them their experiences of the system. Ideation, which is just getting a lot of ideas to address the things that were surfaced during the inspiration phase, and iteration, which is putting those things into play and learning from those experiences. Just sharing some of the data. There'll be a link to the full report at the end there. It's rich with direct quotes from women and birthing people with experience in our maternal health system, and the ways in which the reputations and the quality of the services, whether that be in a community setting or in the hospital, really impacts the care they receive and whether and if they get that care. Universally, women felt that the postpartum period was a real dearth of support and services. So we think that's important to surface specifically. Nandi, anything? Were you interviewed for the actual report, Nandi? Remind me. If you're talking, we cannot hear you. I'm going to keep
Sorry,
moving.
I was gonna check. No, I wasn't in the initial report. It was only Stephanie and I believe Dominique.
Okay, great. So following this deep dive inspiration phase report that identified some of the challenges in the system and made some recommendations, we launched what's called an Equity Action Lab. The lab, it brings people with lived experience that we call context experts to the table with providers of care within that system to basically to work together to design and prototype and test approaches to different identified challenges. And Nandi was a big part of our Maternal Health Equity Action Lab. All these design teams weren't part of that lab, but they were part of a lab. We also currently have a lab we're running specific to the experiences of expectant and parenting youth. So some of these innovations are coming from those teams. These are just generally some of the teams we either ran or are running. The respectful care one was particularly aided by information from Ebony Marcel, who I'm sure most of you know, who really helped us to develop this do no harm checklist, around which we built a 1-hour respectful care training. Nandi, do you want to say anything about the respectful care training? Because I know you've been very involved in the delivery of that.
Yeah, of course. The respectful care training, we train with like Sibley, Georgetown, I believe Mary Center as well. Um, and I would say it was very impactful. A lot of the hospitals and the staff really took heed on just noticing that there is systematic racism in the hospital, and a lot of them even felt like their voices wasn't heard within their jobs, and they really agreed mostly on like keeping the system in check and also keeping each other in check with the do no harm checklist. So, oh, there we go. So
Pulling that
check
up.
your systems, and then they also agreed a lot on I believe it was check each other. Oh no, it was check your listening ears. Um, I know for me, as someone that also now is in the health field, like I believe that for myself is checking your listening skills is important because we can check our systems, but if we're not actually listening with empathy to our clients and our participants, and we are also being a part of the problem. So if anyone wants to put there what they agree on as far as the do no harm checklist in the chat, I would love that. I would love to see everyone's opinion, what they think is the most important do no harm checklist.
Thank you for that, Nandi. And just fundamentally, it is a short 1-hour training that is meant to open a dialogue amongst a team that includes people with lived experience co-leading the training with usually me or someone else on the DCPCA staff. And I'm having a little trouble with slide advance for some reason right now. There we go. We have been doing this training really for maybe 3 years, and we actually went back to some of the folks who we did the training with about a year after doing the training, and we're really pleased to see that they were still utilizing the things they learned and the checklist, and in particular just felt like for a 1-hour training, a lot was packed into that. But again, it was meant to start a dialogue. So one of the other design teams was focused on postpartum care. And I thought this group might be interested in the survey that we did of people and their experience of postpartum care. This was I believe the survey was done in 2019. And a significant portion of them had rated the quality of care in the postpartum period as only poor or fair, and particularly for this group, from a mental health standpoint, they rated postpartum mental health care a full 23%, or 1/4 almost, rated their mental health care as poor in the postpartum period. It really doesn't want to respond to me when I try to move it. Some of the other things we learned from that survey in terms of need, significant 16% reported their biggest challenge as mental health. And you can kind of get a sense of what the other issues were. You know, breastfeeding was very prominent, as well as, not surprisingly, sleep, but mental health really significant. In response to that data, the maternal health team, particularly the context team members, developed what is called virtual mommy meetups. We've really only been able to test this once, but it's a online postpartum support group, and includes a range of different modules. There's Nandi. I forgot your photo was here, Nandi. A range of different modules covered within what is a 12-week, once a week online postpartum peer support group. Nandi, you were not part of the test of this, so I'm not sure if you have anything you want to add to Virtual Mommy Meetup, to that dialogue. I know you didn't deliver our one session on this. We're working with Children's in one of their PROCORI projects focused on perinatal mental health, which I'm assuming you all know about. I think there's someone from Children's on, but we're working with their PROCORI project to hopefully be able to deliver this to some of their participants in the spring and summer. This is just from our one test of virtual mommy meetup, some of the comments, just in terms of what people experienced. I like the one, I think this group should be available to all mothers. It would be awesome if that were true. And I can share these slides if people are interested in really looking. The two other innovations that are currently being tested for us, this is through our DC Next. DC Next is Network for Expectant and Parenting Teens. We have right now, we're testing with the children's design team, teen parent focused doula support program. It's very early days. I think they might have had about 6 young parents pregnant and then parenting teens go through the program, but the early findings are really pretty exciting to us. 100% started breastfeeding. I think 4 out of 6 had births with no medical intervention at all, including pain intervention, and just really, powerful birth experiences. And then Unity and Latin American Youth Center are testing a peer-led sexual and reproductive health program for young parents specifically. And I think they're into their 2nd or 3rd cycle of testing that, and we should be able to share findings from them soon. And let me try to move slide. I think that's it. I've included on this slide the link to the full maternal health report in case you just want to kind of take a look. I looked at it again. It's from 2018, but I looked at it again in preparation for this, and there's still just a lot of relevance in that human-centered design report and in its recommendations that I think anyone can find themselves in something that is targeting, their area of work. I think the work to engage people who are impacted by inequity in the solutions to addressing it that remains very central to the way in which DCPCA wants to do this work and all other work that we're doing relative to health equity with health centers and with the health ecosystem writ large. And that's, Nandi, anything you want to share about your experience as a context team member?
Oh, yes, absolutely. Trisha Quinn hates when I say this. However, during the time when I was so most of y'all know I was assaulted. When I had my second daughter, that's how I got my second daughter. And I was on welfare, on China for food stamps, and I was at a point of like very depressed. I feel like I didn't really have a purpose in my community. A lot of people talk about being on welfare in China, and like you're not, as a Black woman, you're not really worth anything if you're on those in the system or using the system. And especially from my family, they was like, well, you need to find a real job or just things like that to accommodate, because they basically called me lazy. But I was dealing with being assaulted, trying to recover from that, and also trying to adjust from just having a 6-year-old to now having a 6-year-old and a newborn that I really wanted to. It was always my dream to be like a stay-at-home mom and breastfeed and just be the wellness of it all. So I made a decision to like stay home for my children, so they could have the best of who I need to be. I was blessed with a apartment 6 months after she was born. Actually, at first I had the rapid rehousing voucher because I was homeless, and then the apartment called me. Maybe like I gave up because rapid rehousing, you have to go around to different apartments yourself, and you have to pay during that time you had to pay for the application fee yourself, and it's very discouraging, honestly, for people to look at you with children and say like, well, with a child and you're pregnant, they like, the last person I had with kids put stickers on my wall, or we don't take Section 8 vouchers or things like that. And I didn't even have a Section 8 voucher. I had a rapid rehousing voucher, and I was on TANF, so it was really hard. And my last rejection, and I was like, I just can't do it no more. Like, it's hard to get rejected after rejection after rejection. And then a lady called me. She was, "Are you still looking for this apartment?" And I applied like 5 years ago, honestly. I applied 5 years ago to this apartment. She called me. She was like, "Hey, we got an apartment available for you, but you're going to have to get rid of your voucher." And I was like, "I don't want to get rid of my voucher." But she was like, "No, this is a according to income vouchers. As long as you're under the income, you can have this." So I mean, I talk about my faith a lot. I really would thank my faith for that experience, and then just getting an apartment. Unfortunately, because my abuser found where I lived at in 2018, I had to leave. But the good news was that I don't know how Patricia Crin found me or sent me an email. I'm not really sure, but she sent me an email about this opportunity where I can use my voice. It was always a dream of mine to work for nonprofits, and I thought it was over, honestly, when I had my 2 children, because it's hard to get when you over the age of 23. It's really hard to get into like summer job programs and like Connection. I think Connection was my last program with Public Allies, and so her calling me was like, and she was like, "We could pay you a stipend." I literally cried. Like, I always talk about how she saved me from suicidal, being suicidal one time. She said she's gonna say what she always said, but I always give her the credit. Like, a lot of people look at you as a Black woman with children and think you don't have no potential. And every time we would have a meeting, Trisha would say like, "You are amazing," and she really reassures us. So I talk about that. I share my experience during the context team because it really, I wouldn't be a chair with I wouldn't even have been able to create the perinatal mental health task force. Like, I was a part of the creation of that. I feel like I created so much to help the community, and it really, I'm not trying to get emotional. it really helped me be where I'm at. Like, I wouldn't be able to work from home for my daughters at this moment. I mean, I don't get paid enough, but still, I wouldn't be at a point where I could work from home. Like, my supervisor would have never heard me testify. Like, I would have never been able to have that voice if someone would not have said like, "You have greatness in you." I think a lot of people speak about when a person don't have value or feel like they don't have value, which a lot of people in our community do feel like they don't have value. I remember a lot of people during career day, during high school career day, and they asked them like, "What do you want to be when you grow up?" And a lot of the community members, especially the Black men, shared it was like, "Well, I'm not gonna make it past 18 anyway, so I don't even care." So just imagine all those adults that was in the DC public schools that we already know that's already underfunded, feel like they don't have any value or feel like they can't succeed in life because everyone is telling them, "Oh, you're a criminal, you're a thug." They see the shootings on social media and stuff. And though this is not maternal health for fatherhood, we still have to be aware that the fathers being present really helps support black birthers and the hospital, and making sure that they are protected as well, having their spouse, and to really reduce the risk. Having Black fathers around really reduces the risk. I know I go down
Nandi,
rabbit hole.
your ideas and your thoughts are always really far reaching, like really looking at the whole system, and I appreciate that about you. And the thing that I will say is that what working with within the range of context teams that DCPCA has had is that there are so many talented people in community that we don't find. And, Nandi, I think you are amazing, but I know there are a lot of other very amazing Nandis that maybe we're missing because we're not necessarily creating the structures that allow them to contribute or make it possible for them to contribute what they have to contribute, which is very profound. And I think really being part of the problem solving designing, the co-designing and the co-leading and the solutioneering that we have to do. So sorry, thank you, Nandi, for sharing your experience as, you know, in this group and in this work. I appreciate it. So just for folks, I know you guys don't have unending time, but is there any questions or anything anybody has response for Nandi or me? I highly recommend the approach. If you guys come up with some recommendations or ideas that using human-centered design and engaging with context experts to test approaches can be done on a really small scale, and you can learn a ton, and then scale up what works.
I had one question for you. That a lot of the work that you all are doing, we want to make sure is captured in the subcommittee that's mapping the resources and supports in the city, because a lot of the work that, you know, that the context experts and DC PCA is involved with is part of this enormous effort to support mothers. And so my question is there, I mean, beyond you running through kind of the various programs, you know, that are available through PCORI and through, you know, DC Next, is there a way that we can capture all of that work as a resource for mothers in the city in this compilation that we're trying to put together in one of the subcommittees?
For DC Next, we're using some of the resources within DC Next to make sure that at least the trainings that we've created, I forgot to mention, we created a trauma-informed care for young parents training specifically in DC Next. We're working on getting all of that onto DC Next website, so that the hope is that they're kind of modules people can go and get and potentially utilize directly, even if we're not leading the training specifically. So we're working on what that might look like for some of the innovations that will live, I hope, on DC Next's website. DC Next also has a resource inventory for young parent, like services for young parents, that we are compiling on that site. And then we are also in other parts of DCPCA working on community resource inventory writ large, social support programs that are focused on, at this point, housing, food security, and transportation, but trying to grow that information base. Do you guys have anybody from CFSA on this task force? Child and Family Services? No, because they also are, there is some crossover. As you think about developing a resource list of some sort, I would love Deshawn maybe to get in on that, so I can share kind of the resource inventory work that's going on, and maybe bring in the work of CFSA, who is, you know, in the process of developing kind of a warm line that would potentially be a place
Are you
where
talking
people
about,
can access.
are you talking about Thriving Families? Because I'm also,
Yeah, Nandi, you're involved in that too. So yes,
yes,
exactly.
I created the warm line.
Everything, it's like we all are doing what we're in different meetings with the same people, and you know, always trying to bring it all together is the challenge, I think, for everybody. But there's action in that space on resource aggregation.
Yeah,
So
I
we
can
should.
share on that because I was the chair in creating the warm line. So they created something called Thriving Families right now. They have a lived experience advisory committee, where Dr. Bruce is leading that conversation along with CFSA. Dr. Bruce is now like supporting the lived experience team advisory group with what do you call it, life coach trainings. They get free life coach trainings. We're also working on right now. We started on the process of actually starting like the interview questions, who's going to be on the interview panel for the warm line. This is very important because we talked about with CFSA that 85% of Black children are being removed from their homes, and Director Matthews is very present when trying to create something that will decrease that. Not saying to like stop protecting children in abusive and neglectful homes, but to identify what's actually abuse or neglect, or just a mom or dad experiencing hardship, like a dirty house or mental health concerns. So the warm line is really to navigate, is this a CFSA urgent neglect or abuse situation, it would be transferred to the hotline, or is this a situation where they need resources, and then we will support, well, who's ever on the warm line will support them with finding resources. And those lived experience people are also paid as well. Again, really speak about paying. I'm not on there. I was a consultant on there, so when it first started, and I always share back with really paying people with lived experience, because it's really their voices that helps them have their income at this moment.
But always happy if anybody's interested in the respectful care training, co-led by our context team, reach out to me. And I will put my email in the chat just in general, in case anybody is interested in that or anything else that we're doing. And hopefully you can find me. Amy is asking, is funding the barrier to scaling it? Yes. We don't have dedicated funding for it, or any of the maternal health maternal health equity action lab. We do have funding for the some of the DC Next innovations, but only until June 30th, because that's the way the federal government works. So we are always looking for the right homes for these things and the right resources to support them.
And homes are important because me, as a context team member, also, a part of feeding my family will also be at risk June 30th. So I again share the importance of the context team, and even with DC Next, it's a lot of, the context team with DCPCA is a force and reckon with. Like especially the teams, the teen parents that's on the DC Next context team, they are amazing. They work so hard. Like I really, as a mom, I really speak and was a teen mom as well. I really speak with, I really hope that you will support, even with DCPCA with finding a home for DC Next and the maternal health equity lab, because these are people that someone else will turn their eye on them, on us. And because there's degrees, and we know why, sometimes it's hard to get degrees in this city. So I would just share, like, really help advocate for the context team, so the teen parents can continue on and really become policymakers within their roles, and also with the maternal health equity lab context team, which I'm on, can really flourish beyond just what we have to deal with because we're in DC. So yeah.
Thanks, Nandi. Thanks everybody for giving us the opportunity to share, and please reach out if we can provide any further input.
Trisha, before you go, I want to follow up on Amy's kind of question around budget. Since it is the task force task to come up with recommendations, especially around budgeting and funding for things, do you all have a budget number that you have in mind or you can think about? I'll task you with thinking about that you don't have to get right now.
Yeah, no, we have like modeled out some different things, like if we had this much, what could we do type of thing. So I can certainly have share some of that with you, Deshawn, like what some of those models look like, and consider.
Yeah,
We
I
are
think that'll be
always
helpful.
happy. We are happy to have that conversation. Thank you very much.
And then lastly, I'll put you in contact with our resources and data subcommittee, which I think will be a great kind of connection to
Actually,
talk
your
about.
chair, I believe, has already reached out to me.
Well,
So
perfect. Look at
I
that.
don't, yes. So I put my email in the chat. So hopefully she can reach out, and would love to have more conversation about that too.
Yep.
Awesome, thank you. Is there any more questions for Ms. Trisha Quinn or myself? Anyone have any comments on what she shared before we continue with the agenda?
I'm going to hop to my next, but thank you so much again for the
Well,
opportunity to share the work.
and thank you, Trisha, for always advocating for us. And thank you
Amen.
for
Thank you.
thank you.
Take care, everybody.
Take care. Um, thank you all for listening to Trisha Quinn's share on the human-centered design approach. It's so important, especially when we come to a point of more and more organizations listen to people with lived experience, as myself, and Ms. Melissa Bird, and a lot of people on this team have seen just me working hard, or just hear my stories and my voice, and it's I promise you, it's really because of Patricia Quinn and the CPCA and that context team that gave me the courage, the empowerment, the push to just keep going, because I honestly would not have made it past 2019 if that contact team was not available for me. And then the income that we receive, I always say that the income I receive from that is more than my full-time job. That income really supports, make sure my family gets food, because I don't qualify for food stamps or any type of assistance, and making sure that my everything is paid to make sure my children stay alive. And even the other contact team members, I really wish they was here. I just vouch for them, like as a Black woman, you really get judged because you call angry, bitter, or a lot of things. And they have their voice and their leadership in that, and I'm trying not to get emotional, but it's so important to have context team members, and people in the community that has that voice and has that passion or that experience, but don't think they're going to be more than just a Starbucks worker or a McDonald's worker, or like they just don't believe they can get past what they get, and it really will help, even with just being on the system. Like a lot of moms just believe that they can't get past the system because no one's looking to hire us because we weren't able to finish school because of our children, or we wasn't able to go to school because of our children. A lot of our teen parents wasn't able to graduate high school. So just to share a little bit about that. So please, as we talk about the trauma force team, and also about people with lived experience. I'm gonna continue to share mine and be transparent, because I know a lot of moms and birthing people just don't have the strength to be transparent. I know with me, I was at a point where I can't. What was the point of being transparent? Even on other lived experience and lived experience teams, I hear people's voices. It's like, what is the point of me sharing my story? It's nothing going to change. Like, I'm just going to keep talking and nothing's going to change. And I just really want y'all to be encouraged, like, and really hear the stories of the people who've lived experience, and really, really fight for us. Because if it's not for this team, or Deshawn or Melissa Bird, or all of the task force members and the people that's here listening, for y'all to like fight for us, we already know that the council members are shutting down or taking away the budget for food stamps, Medicaid, Social Security, and things of that sort. And then we also know that the mayor put $31 million towards the police force to police more, but we really need more money and funding towards preventive factors. And those preventive factors, like this task force, can create with our subcommittee. So I'm looking forward to our subcommittees. I'm sorry. I'm very passionate about this because it's my life, my story. And I know so many people in my same shoes that also are this. But so our subcommittees. So each subcommittee chair will report out and discuss their next steps for future meetings. I'm so sorry, y'all. We have one, the navigation and access. Navigation and access, would you like to share your report and discuss next steps? Is anyone
That
here?
is,
Oh,
I think that's Amina, and I don't see her online. I can give a brief for someone task force. So they met. Not sure when they met. They were one of the first subcommittees to meet, so there was really a quick turnaround time. And so they went through the questions, and identified 3 kind of barriers that they want to really dive into at the beginning. And those barriers are Medicaid eligibility and the process there, housing, and language access. And so those are the 3 things that they're going to tackle. The next meeting, I believe, give me a minute, is May 2nd, in which they will have folks from DHCF talk about Medicaid eligibility, especially around redetermination.
awesome. Thank you. It's so hard to get out the chat when you're on your phone. It's like you gotta swipe down real hard. Is anyone here, the chair here? And also thank you so much again for volunteering to be the chairs and these subcommittees. Like I really appreciate the dedication as well. Resources and data.
Hi, everyone. Hopefully you can still hear me okay. Can
Yes.
everyone hear me okay? All right, great. Well, we had our first meeting on April 11th. We're scheduled to meet again on May 11th. We spent our time for our initial meeting just kind of discussing some of those available resources and data that's available and related to perinatal mental health. So as you know, the overall goal of our subcommittee was to identify and address different gaps in care in the district. We also identified a variety of resources that are available for women, including mental health professionals, support groups, online and application resources, hospitals, and clinics. What was noted during our subcommittee is that while there is an existence of some of those clinical aspects, we would like to know more in terms of who are specialized in those respective capacities. So we will continue on with identifying as well as those various strengths and weaknesses and resources to develop strategies by improving access to care. Some of our action items that we're working on is developing a database of resources and data needs. And some of the questions that were identified were around the lack of awareness as well as access, and again thinking about providers as well as with the managed care organizations for providers who have to register, whether it's their NPI or register with the credentialing process. But again, just making sure that there's a way in which those respective organizations or individuals who might have an interest in providing this work can actually get captured, and we can be able to have that information to our avail. So some follow-up questions that are available for consideration are, the first one is, what type of claims data are captured by the Department of Healthcare Finance? The second will be, could Department of Healthcare Finance share some data set, including beneficiary level data, that'll kind of give us an idea in terms of where people are right now who might need services, so that we can better kind of outfit, as well as provide more information where we might need more providers. The next question, number 3, was around, are practitioners required to update their NPI number, their managed care organization number, to reflect a specialization in perinatal mental health? And then number 4 was, which entity, if any, are monitoring the quality of services rendered for perinatal mental health in the district? And then finally, our 5th question was, will the Department of Healthcare Finance be open to contracting with or providing guidance for quality control for all perinatal mental health providers in the district? And so, again, as we prepare for our next meeting, we'll continue on updating our database, as well as providing a detailed list of existing data that's available, and continue on providing recommendations.
Awesome. Thank you, Toya.
Thank you so
Again
much.
for sharing. I really appreciate your leadership and everyone that's on the subcommittee for resources and data. Is it data or data? Data. I always say data. Does anyone have any questions for resources and data or data subcommittee?
I do. I just couldn't. Thank you, Natoya. That was a great summary. I couldn't remember what we did, if we discussed or talked about there being some sort of database or drive where we could start to kind of dump things that we hear about and to try to accumulate the resources that we're learning about, even some of the things that Patricia Quinn just shared with us. Are we thinking of doing that? Did we talk about that in our committee?
Was that a question for Natoya?
Either Natoya or Deshawn.
Okay.
Oh, sorry, I was just talking away and I was on mute.
Ah.
I'm glad you all mentioned and say, well, wait a minute, we don't hear you. So Amy, I was just saying that, yes, we did talk about being able to drop in those resources. So I'm just kind of mapping out to make sure everyone will have access to the Google Drive to drop those resources in, as well as to build up the database to include what we've learned today.
Awesome.
Yep.
Thank you.
You're welcome.
Does anyone else have questions or comments? Remember, all of your voices are important to hear, and that everyone here is a personal lived experience, whether you're a doctor, doula, midwife, social worker, or just a witness or director or a administrator. All of your voices are important, and I would love to hear more of your amazing voices. Really, to talk about this. Thank you again, Ms. Toya. One more time, any more questions for her? Hey, if you have any more, please put it in the chat. Awesome. So the next is screening, referral, and workforce development. Is anyone from that team here?
So Sydney, who chairs that, could only attend partial of today's meeting, but she sent me her committee report, and I'll quickly read that, and anybody else who attended can chime in as well. During the initial subcommittee meeting, we confirmed the scheduled meeting moving forward and reviewed and discussed the questions relating to screening, referrals, and workforce. We had a robust discussion regarding the gaps in all 3 limbs of the work. Again, discussion on relevant data on the tools already being used and information being captured. In terms of action items, they developed questions around, one of the areas that they didn't have questions to address were around referrals, so they've developed questions there. They shared research resources for what data is already being collected, and they'll be reviewing data and tools already used in the district. That's all I have.
Thank you, Deshawn. Does anyone from that subcommittee, is anyone here from that subcommittee? I would like to hear your voices on the workforce and development and screening and referrals. Is anyone a part of that subcommittee here? Or does anyone have questions for Deshawn regarding that subcommittee? Is it too late in the day? I feel like next time we should have like Starbucks coffee sent to everyone.
I was going to say, Nandi, this is Andrea. I attended that subcommittee meeting. I think Sydney's notes kind of covered it pretty well. I think we did change the meeting day and time moving forward. So if that was a time other task force members like wanted to attend, like if they couldn't attend at that time, I think we shifted it an hour later moving forward. So if other people want to attend and you're available, I think 3 to 4 now instead of 2 to 3 moving forward. And then Deshawn, I had sent you those documents. I don't know if you wanted to share those. The Mary Center did a 2018 impact evaluation looking at some data around screening and interviewed a lot of providers, I think. I haven't read it, so I don't know if Deshawn, you wanted to speak to that and sharing that with the task force?
Yeah, so there's a number of reports that Andrea talked about. And so they will be posted on the website. I apologize for that RPIO like today, so she couldn't get them posted in time. But they will be up this week. I'm more than happy to share it around to this group via email as well. I think, Sydney, the intention is at the next subcommittee is to take a deeper dive into what the reports say. And next meeting will be May 16th for those who are interested in doing a deeper dive on Mary Center reports.
Thank you so much, Deshawn, and thank you so much, Andrea, my colleague. I enjoy being a part of Mary Center as well. Any more questions? Y'all harder than kindergartens and preschoolers. I promise. I think it's the end of the day. I would love if anyone else like to share their thoughts on before I move to the next subcommittee. Anyone? Okay, tough crowd. This is the end of the day. All right, so public awareness and systems capacity is the chair available to share the reports or the discussion on next steps.
Hi, yep, that's me, Crystal here.
Crystal.
So similar to what we're experiencing now, with like not really getting a lot of vocal response, I thought to create a poll, and I think we were even talking about this at the last task force meeting, about using a poll or survey to capture some data and responses. So I'm going to share the survey that I sent out to everyone that came to the subcommittee meeting. We met last week, I believe it was, and there were about 11 people that attended, 2 of them being Deshawn and I. So we got 8 out of 9 responses that day. So I'm super excited because that's like 99%. That's better than just, asking and not getting a response. Still working through synthesizing that information. So I broke up the questions of this subcommittee into 2 sections. So the first 3 are what you will see on the survey here, and then I'll do the next 3 at the next committee meeting, which will be subcommittee meeting, which will be May 18th at 4 p.m. And so, yeah, so I think that's a quick overview of what happened. Any questions?
Can you repeat that, Crystal? The next meeting is May 18th at 4 p.m.?
Yes, that's correct.
Okay.
Mm-hmm. And also just a little subcontext about the survey. I, again, used the questions that the subcommittee has, but just kind of added some like prompts and my thoughts as if, the person completing the survey is talking to me, a doula, a mom, someone who's been, involved in this space of perinatal mental health. So I hope that is well received. People that did respond during the subcommittee, kind of echoed that sentiment as well, that the survey was well laid out. So just as you're going through, that's why my voice is included there. But again, just to make people feel a little more comfortable in providing their responses so that we can have, a wealth of information to build our recommendations off of.
I think that's a terrific idea. Yeah, awesome idea. And I'm so glad that you got as many responses as you did, and we can't wait to hear what they are. And I'm wondering if the use of a poll survey could be something that may engage more, more discussion and more participation, more engagement from the broader task force.
Mm-hmm. Yeah, I think we should test it out.
I wanted to say I really appreciated the survey. I went to the meeting. I think I'm someone that sometimes I can get lost when someone's speaking. So like having some words that are written to respond to is really helpful. So yeah, thank you for your survey and the thoughtfulness you put into that.
Great, great, great. Thanks for sharing that.
Thank you again. Thank you, Crystal. And thank you for being the doula and supporting our birthers and making sure that they get the level of support they need, and also being present in the task force and being the co-chair. I really appreciate you so much, and all the subcommittee chairs. I would love if everyone can do a clap it up for them or some hearts for them, please. And the chat is really a lot of leadership and hard work into being a co-chair. As I know now, it's a co-chair here, and just even advocating for birthers, even clap it up for the co-chairs and the chairs of the subcommittees and the task force and everyone that came today and made time to come. I really just even give yourself a clap or a pat on the back for advocating for Black birthers that deal and suffer with anxiety, depression, PTSD, and again, I'm expressing that it means so much for myself and other people that need that support. So give yourselves a hug, a clap on the back, a pat on the back, a clap, and some love, and also some Starbucks coffee. I'm sorry. I'm happy to be here. So please forgive my silliness. I'm really, really happy to be here. And just seeing all the people participating and being a part of the task force, and also being any public witness. So that's next. Is anyone? Oh, I'm sorry. Does anyone have any questions for Crystal? Any more questions for her and her subcommittee? I'm sorry, my internet is also going in and out. Can y'all hear me? Really?
Yeah, we can hear you. We're good. We're with you.
Can I get a thumbs up or yay if you're on the phone? If you can hear me, people, I just want to make sure I'm heard. Any yays on the phone for people?
We can hear you. Can you hear us?
Yes, I can hear you, Amy. I was
There's a
just
lot of thumbs. I'm seeing a lot of thumbs.
I was trying to get everybody on the phone.
Popping up.
Participation. I could have been a teacher because participation is important to me. So I'm just.
You could. You're good at it. I like it. It's
I do
very
have a question.
gentle but effective peer pressure. I love it.
Yes.
I have a question. I respond to peer pressure. So I was curious, Crystal, if you want us to share that survey broadly in the communities or where we work, or kind of, yeah, if that should be shared beyond the task force, or just guidance on that.
Please do. Please do. I emailed it out to all of my contacts. I put it in birth worker, face group messages, everywhere. I think that's important. Again, as we were starting this meeting, having lived experiences in that, and as many lived experiences as we can. So please do. And if you want, I can share the email that I sent so you can see my messaging, if that helps to have, since my voice is on the survey, then you can, they can connect the dots. So I'd be happy to send that to you or to whoever needs it. I don't know if maybe Deshaun can help facilitate sending this messaging along, but yes, I'm open to everyone that's able to respond to the survey.
Crystal, I don't want to put you on the spot, but I totally just took a peek at the survey. I wasn't able to make that subcommittee meeting, and I took a peek at the survey, and I think it's also excellent because you essentially sort of decoded the questions and made them more relatable. And I'm thinking that some of the questions, particularly for the subcommittee for navigation and access, where we're asking about, how the district can focus on being trustworthy, for example, like this poll would be a really effective way to be able to get some of those questions answered more broadly. And so I don't know what other people think, if there would be any interest in trying to plug some of the questions. I mean, some of the other subcommittee questions are they're less poll amenable, but for the ones that I think are really amenable to a poll, what do people think about putting those in a survey form that we could then circulate with our networks to get more lived experience, to get more provider experience, people that can't come to these meetings?
I'm all for it. With gift cards. Yeah, incentives are great too to get responses. Um, yeah, some type of, again, incentive would be wonderful. I'll let anyone else speak.
Well, I'm sorry. I also think that having some type of since April, well, April is too late, but even in May, since it's Mother's Day, or Birthday Day, I feel like we can do some type of focus, well-being focus, like promotion, like a well-being, um, like a pretty broad, like extravaganza, like I'm sorry, big, like really focus on well-being of birthers in DC, and supporting them. So just I don't know, really focus on well-being, adding, saying like you're all valuable, adding value, saying like you are valuable, or like talking about well-being and like ways to do like self-care with your children. Even adding the context team with DCPCA and children's. I would say it would really support everyone in the whole, honestly, as well. If we do like a big, I don't know if we have the budget or anything, but like a really big well-being for birthers in DC, just really focusing on stress relief, how to help with anxiety, or just even, I don't know, even having like counselors or therapist presence to do like on-site screening, and then we will also have the survey where they could also receive a gift card for the survey, or like even like a gift, like a big gift or something, like what do you call when you do the raffles, like a raffle thing, like, I'm sorry, a lot of people know my brain starts moving for like solutions, and I start planning events that I don't have the time to plan, but I'm sure someone on here has the skill set to plan the entire event and find a great venue for moms with mental health concerns and things of that sort. I don't know if anyone else wants to comment on that idea, or also on Crystal's other ways Crystal can share the survey.
Nandi, I think all those ideas are excellent. I mean, my first thought is I'm not sure about if the task force is able to execute ideas or if the task force is really focused on identifying ideas. Because as you were talking, like I was just staring at that question, like how can the district focus on being trustworthy? And like the district doing an event like that would be a way that the district could develop and trust, could communicate trustworthiness by being able to celebrate mothers and birthers, and being able to offer support in the Mother's Day month, and recognize all that mothers do and birthing individuals do to kind of hold everything up. So I don't know if we're able to execute ideas or just capture them, but I think every idea you just said is great.
Yeah, Andrea did also share in the chat about maternal health month.
Mhm.
And that being, I keep forgetting when the summits are the for the mayor's DC wide maternal health summit.
Mhm.
So I feel like she's been an advocate for mamas and reducing the infant mortality rate in DC. Since we know it's like extremely high. I believe it went up actually. Oh no, please don't quote me. I'm sorry. As from what I remember, it was 3 times the rate inside of the whole United States within DC. Someone can probably say that better than I can, but I always scramble it up. So yeah, I think that would be a great thing. I really would love for a DC Black birther to be on the main stage, where a large platform of people can hear their voices, not just on the side, in one of the small groups. The context team did share about the context team and the respectful care training at the first maternal health summit. We did have a lot of people come to our uh, like session. I'm keep forgetting what it's called. The breakout groups, the breakout rooms. A lot of people did come to our session talking about the respectful kid training and the context team. We shared our experience. That was our first really being outside of just DCPCA. Then after that, we really felt like it would be very impactful. And a lot of people in our breakout room really felt that hearing a large platform, hearing our voice, like a lot of celebrities, share about their experience, and they have the resources to, honestly, they have the resources and funding to share their experience. And it's just as important for them to share their experience, but they get, news outlets and things like that. But it's a lot of Black birthers and Black mamas in DC that is really suffering in silence and would love to have the opportunity to share their voices on a large platform and really speak out to how in DC alone, a lot of 3 times the rate of the whole United States is really being affected by the infant mortality rate. So I feel like their voices being heard, especially speaking on like helping them, coaching them with speaking on depression and anxiety and how it feels to be a Black mama in DC or a Black birther in DC and struggling with being like low income or even high income. Like it's really hard being a mother in DC and having children and just suffering with any type of mental health concern. So I really believe if we can create that, or someone here has any advice towards that, and just really getting the word out, I believe part of Spaces in Action, Space in Action with LaDawn Love. She always say that that numbers matter. So the more numbers you have, the more voices you have as well. So does anyone have any comments? And then next is the public comments. Is next. If anyone doesn't want to share on what Crystal and everyone is speaking of on that, but next is we are opening it up to public witnesses and public comments. Sorry, I'm getting nervous. But public comments. Sorry, y'all. This is exciting. But public comments. So everyone has an option to share. You are also able to share in the chat if you're shy, or if you can message me or Amy privately, or Melissa or Crystal, any other sub shares privately as well. I do understand that, it's hard when a lot of people are on a call and then voices, it just could be um, hard sometimes. So I do understand that. So if you want to message us privately, or Mr. Deshaun, you are more than welcome as a public witness or anyone else want to talk it. And I'm going to stop talking.
I'll chime in real quick. This is Crystal again. Just thinking about an event, like I know there's a lot of moving parts to make that happen. I think it would be wonderful to do that, but to simplify the ask on everyone, maybe an alternative idea is doing something on social media. I don't know if we could like make a perinatal mental health task force Instagram or whatever, and like allow people to send in short videos, like ask pointed questions, and you can send in a video response or comment, whatever whatever your thoughts and ideas are, maybe that's a simpler way to still get our messaging across. And right, like subcommittee chairs can, do a short little video about, this is who I am, why I do what I do, this is what we're asking of you all, so that we can make sure, we have robust policy recommendations from lived experiences. So just my idea, knowing that event planning is a lot. So yeah.
I like that idea. I was thinking about like whether Mary Center would do that, but I feel like they get a little funny about participants, like, and researching. It's not research, but sometimes asking for feedback. So it's something, I like the idea of having a task force led approach on it. And I put a question in the chat about whether there was any budget like that could be used from the task force budget, like to have some sort of incentives or gift cards for people that respond, or a raffle, or I don't know, something like that.
Yeah, so there is budget for the task force, and I am currently chatting folks to see how to draw down those funds to offer gift cards. That is the only problem, but but it should be able to. Point is, we should be able to do it. I just need to figure out the process to do that. So stay tuned.
Awesome. Any more public witnesses, or is any public witnesses here? I don't know, Deshaun, if I have to say another way, but is any public witnesses here that would like to speak on just the paternal keep saying prenatal mental health task force, all the subcommittees that spoke, and everyone that shared their experience with the task force, and even thank you again, Crystal, for the survey, and everyone on that subcommittee team. Would anyone like to share their comments or share some comments?
Is it okay to just come off mute, Nandi, and just start talking?
Oh, yes.
Sorry.
I'm sorry.
No,
I didn't
you
say that
probably
part.
can't
So
see.
yes,
No. You, you probably
sorry.
couldn't see my hand raised.
I'm
But this
sorry.
is time for
No, I
public
didn't see your
comment,
hand.
right?
I'm sorry.
No,
Yes,
no.
public comment,
No.
please. I'm sorry. I can't see if anyone hands is up. I do apologize if anyone hands up. So please come off of mute. And also, if you would like to share in the comments, like, hey, you'd like to go next, or something, or send me an email. I can put my email in the chat as well. Or I'm not, because I'm worried about the people that's on the phone that might not be able to access the chat. So I can send my email or my contact if need be, if you want to share a comment. So yes, go ahead, Leah. Sorry.
Oh, thank you, Nandi. No. I appreciate it, and I don't want to cut anyone else off. Yeah, I just wanted to say that this has been a great meeting. I feel like I learned a lot, and we have made some kind of good, really nice, tangible steps forward, it feels like. I was just curious, in terms of like gearing up to like write a report, is there going to be like a sharing of like what that process might look like and how folks can get involved? Will there be like an outline process? I've never been in, even observed one of these task forces, so I was just kind of curious what that process might look like and how we can be supportive in that as we kind of, look down the the timeline that we have and whatnot.
I'm happy to take give an initial response, and thanks, Leah, for your question, and good afternoon, everyone. This is Melissa. What we and I will caveat all this with that the co-chairs and I haven't had a chance to get to this part in our discussion and present it to the task force committee members as well. So I say this just more on how other task forces have been handled, and there's a possibility we won't follow this exactly. But typically, when there's a report that's required to be submitted to the council or the mayor, or however it works, with the subcommittees, We will look for recommendations to come from those subcommittees up to the full task force for review and input and comment. Then once we have all of that kind of initial feedback, we will put it into one document with several iterations of review from the group writ large and have feedback, and then likely we'll kind of put the bow around it, if you will, through a vote and make sure that the task force members are all in support of the final written document. So that, and then I presume too, we'd probably soon we would have presentation at one of the meetings towards the end of this initial work, where Leah, we would also present on it and have public feedback as well. So it's not just limited to the task force members, but certainly the work in the subcommittee, in the subcommittees. I think that's where, you know, the best is the best avenue for input and shaping those recommendations that will ultimately come toward to the task force. And Amy and Nandi, you guys should definitely, or anyone on the task force should really speak up if that feels fundamentally not right to you all. And Leah, does that kind of answer your question as well?
Yes, it does. I think I was, you know, and I appreciate that a lot of how we might work through that and whatnot. And I think part of me was curious too of how the recommendations might end up being bucketed. Is it going to be like a laundry list, but I might be getting more into the details? Or are we looking at kind of how we might separate? I think in some of the conversations and what has been previewed for next week, like some of them are not full on clinical supports, right? It's a lot of, you know, it is also things like guaranteed income or housing supports and whatnot. And so how we might think about working through all the variants that can improve and address perinatal mental health in the district. And so I'm sure that you all are thinking of that and whatnot, but I just kind of wanted to name that. And I was in Crystal's subcommittee, and I feel like that is some things that came up in that subcommittee, Crystal, you know, in the conversation and in the survey, is that there are kind of these different avenues we might take to really broadly address perinatal mental health and whatnot. So just kind of wanted to name that and call that, but that's really helpful to just kind of understand how we'll work through that process. So I really appreciate it.
I wonder, and you know, my brain tends to go into the kind of practical how this is going to work. And I wonder if, as we are now creating a system where the subcommittees meet between our broader task force meetings and then come back and do a report out in the broader task force meeting, I wonder if we can create a document that is a shared document that becomes a place where some of the report out gets recorded, so that we can actually start to have like a living, breathing document that we can then turn to when we start to actually write, you know, do the writing, because I think that there's a lot of, I know, I'm not entirely sure if every one of these meetings are recorded, but I think there's a lot of ideas and there's a lot of really important information that I think should be captured in writing that we could go back and refer to when we're actually writing the report. So I don't know what people think about that the report outs would actually go into a document.
Yeah, so Amy, the template so all the subcommittee chairs have a subcommittee report out template that they're encouraged to fill out and send back to me. So the idea is to kind of post that on the website as a living document of what's going on in the subcommittees. I think, or I may have taken it out, is a section on suggested recommendations that they have talked about. So that is also recorded or kind of collected as well.
Thank you.
Sorry. Thank you so much to Sean and Leah for commenting. Is anyone else like to comment? One for public comments for witnesses. Again, if you feel led, and also if you are able, or if you're not able to right now because you're working or you're caught up in a meeting or anything of that sort, you are more than welcome to email me, Deshawn, Melissa, or Amy, or one of the people on the subcommittees if you have like one-on-one questions for them as well. So if anyone here from the public witness like to speak or comment, we would love to hear your voice.
I can just jump off mute. This is Andrea again from Mary Center. I was curious if there's a timeline at all that we have for just for our work together, like when we might like start drafting the report. And I feel like there was someone was saying last time that there was maybe like 2 months before we want it to be our work to be complete, we should have the report done. And I don't know anything about that process, but just curious if there's a timeline that can be developed, if that makes sense.
Yes, so great question. The idea was to start drafting in August and have final approval for that to kind of go through the whole approval process. So the idea is subcommittees starting as they are forming or have they initially met, just kind of start to think about what recommendations are coming out and then have that submitted by August 1st, or ideally the end of July, so we can start to draft that report. So you're right, it's about two months out for the drafting process.
Thank you, Andrea. And I'm sorry, I keep forgetting to say this way. If anyone would like to come off of mute, I don't know if it's the same as Zoom, pressing *6 if you're on the phone. But if anyone would like to just come off of mute and speak for the public witnesses, or if anyone on the task force would like to speak. I do not want to get in teacher mode, but mommy mode. Okay, well, thank you all for even just being a listening ear. I feel like that's still impactful. Just listening and just being present. That is still very impactful. I believe in. A lot of people call me Flower because I'm always talking about flowers, nurtures, and stuff. And one thing I've started saying was like it's very important for people to create a garden, especially just everyone, just humans, creating a garden. Like a community that nurtures each other, and everyone has that place. I always say, like, I wonder if bees know when they get the nectar from flowers, if they know they taking pollen and helping like more flowers be created to bloom. Like, I wonder, like, if they know that. Like, I wonder if the flower appreciates, or the plant, or the fruit, or the the garden appreciate when the gardener takes away the weeds, take away the weeds, and just everybody doing their part. So I feel like everyone has a part in this, and even if you you just don't have anything to say, or I do want to encourage that your voice is very impactful and it really matters. Like to us all. Like, I really stopped myself from crying a lot today because like last week was my birthday on Tuesday. And I just felt very lonely as a mom of two, and I was like, I'm 32, I'm not married no more. I mean, I'm not married no more. was never married, but I'm not married, and it's very depressing just looking at your children and seeing that you might be at risk of not having a job because you are limited to like grant funding. Both of my jobs is limited to grant funding because of DC. I mean, what is it? Mary Center Fatherhood Program. I'm a family support worker on the Fatherhood Program. That's grant funded under the CFSA. We really don't get paid much on that at all. I have, I think Andrea, I think you're a home visitor. I keep forgetting. No, Jenny is a home visitor. I don't think Jenny is here anymore. But if anyone else that's a home visitor or family support worker even want to share their story about how hard it is being that, or even a doctor or administrator or doula, just sharing your story on how hard it is to even, work in this field and not have your voices be heard and not feel appreciated. Like, even if you want to put that in the chat, I'm gonna share that. Like, it's hard, especially me dealing with anxiety, depression. Like, I really had to fight. I shared at the most recent budget hearing as a family support worker because I'm very, very passionate about my work. And I've done a lot of work with programs and many organizations and nonprofits in the city. And I really say that humbly, please, please don't have that come off being arrogant. Like, I really, really am proud of myself. And I have to tell myself that every day because my mom would constantly tell me that she would have had an abortion. Like, she told me that on Mother's Day, and even on my birthday, she accidentally called. I'm just sharing my experience, but she accidentally called me on FaceTime an accident and like was sharing to like strangers while she was on a cruise that like her daughter is broke and like she will only be able to be on welfare. Like, it's very painful. So I'm just trying not to cry because I'm in public, but I just really share and tell you how important it is for me to see so many people on the calls and so many people agreeing to be on the subcommittees and co-chairs, or even like Melissa Bird and Patricia Quinn and Amy and Deshawn and Crystal and Andrea, who also like always like just give me some support, like, always pouring into me. Even my supervisor Felix, who's not here, they're always pouring into me and encouraging me to keep moving because my family does not do that. They always tell me that I should have been better, or I should have just started a restaurant, or waited to marriage to have children, or had an abortion. Like, just it's really hard. I deal with depression a lot because of it, and society will tell you if you're not a married woman and you have children, you're not valuable. So with social media, even social media as an outlet, I don't know if anyone like watching TikTok or Instagram or like any type of reels, for a laugh or anything like that. Just sharing, just laughing, or just trying to make the day go by. Just taking like self-care. How important it is for you, but then you see like someone saying like, oh, you're a single Black mother, like you would never get married. And I really want my children to experience seeing a healthy family, or even just a healthy single family, but it's really hard. Again, please someone stop me if I am going. Hopefully I need to land. Please, Nadi, be quiet if I'm like talking too much, but I speak because it's the only time I really get to speak, and the only time that people is when I'm in rooms like this where people are wanting to listen, and people are speaking for me and advocating for me, or just even giving me like, Nani, you are amazing. Like, so again, I appreciate. Again, Patricia Quinn is gone. She really activated that seed that was in me. Again, I share all the time that everyone has a seed within them. You don't have to put a seed in anyone. Everyone already has a seed. Like, you're already valuable. You already have a seed. And just sometimes just take a gardener to come by, just like take away the weeds, like the negative mindset or the negative energy around you, or negative plants that stunt your growth, or just even being in the correct place. I really believe if I wasn't in the correct place where I am now, that I would not have the funds to feed my family, and also the ability to encourage and help other Black birthers flourish and grow. Because again, Black birthers are always told that they are not valuable. Again, I really want to express that. So again, I share how I felt about being, a mama in the society, and how I have a list, a notepad where I tried to, commit suicide, and how it was many times I would not have been here because again, we just don't have support, especially the ones that really, really try to work hard and make change. So, thank you all again. I don't know what else we need to do for. Oh, and thank you all for the birthday wishes. Yes, last Tuesday was my birthday. I turned 32. I really felt alone that whole week because my family just did not want to celebrate me. And I really felt like I came in the wrong parade. Like, no, my mother doesn't even want to tell me that she's proud of me. And the only time I hear that I'm proud of you is in these meetings or with my supervisor or Mary Center or DCPCA with Patricia Quinn. Like, that's the only times I hear I'm proud of you. And that's like 20% of my life. I know people got to jump off. I'm so sorry. So I share my experience. I don't know if it's my responsibility to say meeting is adjourned and or Deshaun's or Melissa's or Amy's, but I just wanted to share that. Sorry.
Thank you, Nandi, for sharing with us. And also, happy birthday. If we were a singing group, I would say let's all sing happy birthday to Nandi. If we were in person, maybe something next time. Maybe we should plan an in-person meeting so we can sing happy belated birthday for Nandi. That is all we have for today. Thank you all or Crystal, did you have a hand up or you can work? Oh, okay. I saw something. And I know we're a bit over time. That is all. If you have any questions, please feel free to reach out to Melissa, Nandi, Amy, or myself, or one of the subcommittee chairs moving forward. So thank you all, and see you next time.